Hello friends, today I am back on Unit 3 and the topic for today is Narcotic and Psychotropic Substances Act 1985. I would be covering this topic in 4 presentations or 4 lectures. So let's go through the content of the lectures. In this act, that is NDPS Act, or you can say Narcotic and Psychotropic Substances Act, I would be covering history, introduction, objectives, definitions, Narcotic Control Bureau, that is the department which controls this system, authorities and offences as usual if of any act, National Fund for Control of Drug Abuse, cultivation, production, sale of opium, offences and penalties. So in coming up 4 lectures, I would be covering this entire content. In the present lecture, I will be taking or dealing with history, introduction, objectives and definitions. In this part, I would be covering the history, that is how the act developed or what was the need to develop this act. Introduction, what were the core points that were covered or through which it has to follow. Objectives, the points that why it is essential for the development of this act and how it will deal with narcotic substances, and some important definitions, or you can say the points which will be coming up in this lectures, or you can say in this act. So let's start with the history part. Cannabis. Cannabis smoking in India has been known since at least 2000 BC. You can see that is 2000 BC. The use of these narcotic drugs is as dated back as 2000 BC, that is before Christ. And if mentioned and is first mentioned in Atharvaved, which dates back few hundred years BC. So here you have seen that the use of narcotics is as back, or you can say as old as Atharvaved, because the first detailed information was brought through the Atharvaved that there are some narcotic products. Cannabis is one of them. As we have categorized it further, we have seen that cannabis is one of the narcotic products that has been used as old as mentioned in Atharvaved. The use of these narcotic products is very much old. The statutory control over narcotic drug was being exercised under the Opium Act 1857, the Opium Act 1878 and the Dangerous Drug Act 1930. So before this current act that we are talking about, prior to this there were 3 acts which were Opium Act 1857. Here we can see the Opium Act 1857, the Opium Act 1878, that was the latest version of the act, and the third one is the Dangerous Drug Act 1930. These were the 3 acts which were controlling this narcotic and psychotropic substances before this act actually came in. There were some of the drawbacks in all these 3 acts which were cured, or you can say overcome in the present act we are going through. So it is as old, we can see the regulation is from 1857. So it is as old as 1857, or you can say the Atharvaved which we are talking about a bit before. So this was the history. Let's go through the next. Laws of this kind have failed to produce any concrete result. We can see that any concrete result we cannot find with these implementation of with these acts. So some people feel that these laws have encouraged such crimes as illicit traffic. I would be dealing with this in further slides, illicit traffic and all, that how the corruption has built up using these narcotic drugs, and the main role of these acts is to stop these corruptions. So the law was built up, but we can see that there were 3 laws which were controlling it that is Dangerous Drug Act and the Opium Act and its latest version. But there were some drawbacks in these acts. Therefore, to overcome those drawbacks, this new act was formed and regulated. India had no legislation regarding narcotics until 1985, because in previous slide we have seen that it was 1857 that the first act, that was Opium Act, that was brought forward. So till 1985, there was no control over these narcotic substances. So the act was developed. Now coming to the introductory part, or you can say if we have to write the answers, then we should have an introduction also to the act. So here are some of the points that I will focus now. The Central Act like Opium Act 1857, the Opium Act 1878, that is the latest version of the Opium Act, and the Dangerous Drug Act 1930 were enacted long time ago. These three acts have been used to regulate the narcotic drugs. With the changing circumstances and the developments in the field of illicit drug trafficking, I have just now used the word of illicit drug traffic, and the drug abuse at national and international level. Here there is one question about illicit drug trafficking. So till now you should be aware of this word. What is illicit drug traffic? That is the drug abuse of narcotics product. When there is illegal supply, or you can say smuggling, of these narcotic products, it is termed as drug trafficking. So we have used this terminology over here, that is illicit drug traffic and drug abuse at national and international level. So the main aim, or you can say the objective of this act, is to control illicit drug trafficking. Many drawbacks have came into notice in the said acts. What are the said acts? That are the three acts, that is the Opium Act 1857, the Opium Act 1878, and the Dangerous Drug Act 1930. So there were many drawbacks in these acts which were used to control over the narcotic and psychotropic substances, which leads to the development of this present act. So let's go through the other slide. The government of India has repeated these old acts and repealed these old acts and passed the new act, that is the Narcotic Drugs and Psychotropic Substances Act 1985. These acts established in 14th November 1985. So the latest version which we are talking about is of 1985, that is about 100 years more have been taken up. The NDPS Act, as it is known popularly, is meant to face a very important social problem, that is drug trafficking, deal or trade. So here also comes one more point, that is illicit drug trafficking can be termed as dealing or trading in narcotics in the wrong way. The procedure that has been given by the government and the laws which are made by the government, if not followed, is termed as smuggling, or you can say the misuse of the drug, of narcotic products. So the main aim of this act was to control drug trafficking or illicit drug trafficking, which literally means deal or trade. So till now you have been made up an idea in your brain that we are talking about narcotic and psychotropic substances, which literally results in illicit drug trafficking if not controlled by the government. So here are few points. So let's go through the last point of introduction, that is the Narcotics and Psychotropic Substances Act 1985, commonly referred to as NDPS Act, is an act of the Parliament of India that prohibits a person to produce, manufacture, cultivate, possesses, sell, purchase, transport, store and consume any narcotic drugs or psychotropic substances. So with this point over the slide, the idea is made a bit clear that we will be talking about narcotic substances with respect to its cultivation, possession, sale, purchase, transport, store, consume. So any of the matter related to narcotic drug has to be controlled under NDPS, and the full form of NDPS is Narcotic Drug and Psychotropic Substances, and the latest version which came into force was on 14th November 1985. The Government of India and the legislation built up this act and initiated in the whole India. The terms and the conditions which has to be followed by the people in concern with narcotropic substances. So now coming to the topic, that is objective. If we talk about the objective, some points have been made clear till now, like the aim or the objective to build up this act was to consolidate and amend the laws relating to narcotic drugs, which is the first one. If we are talking about NDPS, then it is the narcotic drugs. So to consolidate and to amend that, the last laws, the flaws and cons which were prevailing through the last act has to be improved in this one. So it was amended. The word we have used, amended. Why it is amended? Because the lines were laid down before 1857, but the new version of this act has been amended. We have taken some points from those old act also to consolidate and to amend the laws relating to narcotic drugs. Now coming to the next objective, that is to make astringent provisions for control and regulating the operations relating to narcotic drugs and psychotropic substances and matter connected therewith. So here comes, that is operation relating to narcotics. What does it mean? Narcotics means those drugs which are affecting the brain. So to make astringent provisions for the control and regulation of operations relating to those narcotic drugs. And what were the operations? We have just gone through the slide. What were the what were the operations? That was to produce, manufacture, cultivate, possesses, sale, purchase, transport, store and consume. These are the major operations related to Narcotic and Psychotropic Substances Act. So if we are talking about the operations which are related to narcotic drugs are the consume, the possession, the selling, the transportation and the utilization of narcotic drugs. So we are talking about these operations with respect to narcotic drug. So with this we have cleared the objective of the act, that is to consolidate and amend, and next is to control and regulate the operations relating to narcotics. So these are the four main words that you have to learn about, is consolidate, amend and control, regulate is the fourth one. So with these four words you can learn the objective of the act, that is to consolidate, amend, control and regulate. What to regulate and what to control? The drugs which are coming under narcotic drugs, because they are having psychotropic effects, that is effect on brain. So that was the main objective of the act. To considerably enhance penalties, particularly for trafficking offences. So in this point I would like to say that the penalties which have been decided before have been increased now. because if we are having less penalty and more benefit, then people goes for drug trafficking. And to stop that drug trafficking, we have to enhance the penalties that are being applied over it. The offences that the common people are doing has to be controlled by increasing the penalties over it. So the amount of penalty has been increased in the current Act. To make provisions for implementation of international conventions relating to narcotic drugs and psychotropic substances. International conventions means that there are many laws which are regulated worldwide. So if there is one or two few rules with respect to narcotics, then they have to be implemented in international convention. That means if it is applicable for our country also, we will be including it in our Act also. So that comes under international conventions. So with this point, we have completed the part of objectives. So now coming to the definition part, or you can say some terminology which is related with this Act and you must be familiar with it. So the first one is addict. Addict is the person habitual to regular use of any narcotic drugs or psychotropic substances. And the property is known as addiction. Like we can say, for example, that the person is addicted to tea. Tea is also having caffeine, which is a psychotropic substance, or you can say narcotic substance, which affects the brain and with the property of brain. So some people are habitual of taking tea. That is a common example which I am talking about to explain about the term addiction, or you can say the addict. The addict is the person and the property is known as addiction. If any person is addicted to something, or you can say is habitual, it is in the habit that if that the person has to do it by any term, then it is termed as addiction and the person is termed as addict. So if we are talking with respect to the narcotic substances, if the person is habitual of taking drugs, this is the most common word that you can really correlate with the current scenario, that is habitual of taking drugs like morphine, codeine, heroin. These are the drugs which are people currently making their habits to take it regularly. So they are habitual of these drugs. So you have to be clear with this word, that is addict and the addiction. And with respect to narcotics, we are talking about such drugs like morphine, codeine, heroin, etc. So the first point is cannabis. Cannabis is one of the narcotic substances that has been using since early times. Cannabis in Hindi is known as charas, that is the separated resin in whatever form, whether crude or purified. Cannabis has been used as pure form or in crude form. Obtained from the cannabis plant and is also includes concentrated preparations and resins known as hashish oil or liquid hashish. This is the common preparations that has been used by the public now these days. So cannabis is one of the narcotic drugs that has been used, and it is in Hindi known as charas, that is charas ganja, that we commonly talk about the drugs like charas ganja. These are the narcotic products that are affecting our brain and making the person habitual. So coming to the next point, we have medicinal cannabis, coca derivative and cannabis. Cannabis we have termed as charas, and now here we are talking about ganja. So first is medicinal cannabis. A bit difference between these points, that is medicinal cannabis and cannabis. So medicinal cannabis, it is any extract or tincture of cannabis. That is tincture of cannabis, that is alcoholic extract that we use for making drugs, or you can say for making some medicinal preparations. we use tincture of cannabis. So when we are talking about the tincture of cannabis, we are dealing it in medicinal form. So it is termed as medicinal cannabis because we are using that cannabis to prepare some medicine. Now coming to the next, that is coca derivative. It includes crude cocaine, which can be used directly or indirectly for manufacture of cocaine. We have used this word just before, that is cocaine, heroin, ganja, charas. We are talking about those. That coca is in Hindi, or you can say in other terminology, can be termed as cocaine. Cocaine is methyl ester of benzoyl ecogonine. That is a chemical name, or you can say the IUPAC name for coca that is obtained from coca plant, and it's salt. So we are using it for preparation of many medicinal preparation, and people on the other hand, if we are using directly taking it as a drug, then it comes under narcotic substances and psychotropic substances, and we have to control over it. Now if we talk about cannabis, it has the ganja also. Ganja, that is the flowering or the fruiting top of the cannabis plants. The charas and ganja are the product of the same plant, but the difference is from the part from which it is collected. So if we are talking about ganja, then it is the flowering or fruiting tops of the cannabis plants. So here we have talked about some of the narcotic substances that we are using. Now coming to the next one is opium. Opium, it means the coagulated juice of opium poppy or Papaver somniferum, the biological name of it, the plant. It is also the plant from which we are using or extracting the opium, and its mixture with or without neutral material. So opium is also one of the narcotic substances. Opium poppy, I have just told you about the opium poppy. Opium poppy is the plant from which we are extracting opium. It includes the plant of Papaver somniferum. I have just told you about this word, Papaver somniferum. That is the name of the plant from which we are collecting opium, and the other species of Papaver from which the opium and the phenanthrene alkaloid can be extracted. The phenanthrene alkaloid is the terminology, or you can say the chemical terminology, or the IUPAC name, or you can say the chemical nature of opium. So now let's talk about the third one, that is narcotics. I have used this word entire my lecture. So what are narcotics? An addictive drug affecting mood or behavior, especially an illegal one, which induces drowsiness, insensibility and relieves pain. That if we are we use narcotics in asides and other medicines to relax the human body in such conditions which are prescribed by the doctor. That is the authentic part to use these narcotic drugs. But once the person is using by itself and direct to induce drowsiness, to insensibility and relieves pain, these are the pharmacological properties of this narcotic drugs like opium, cannabis we were talking about. So these are termed as narcotic drugs. The last one is psychotropic substances. It means any substances, natural or synthetic, or any salt or preparation of such substances or material which is included in the list of psychotropic substances specified in the schedule DET, clonazepine, aphentamine, pentobarbital, pentozocaine. These are some of the terms that we are using with respect to psychotropic substances which affects the human brain. So this is the definition of psychotropic substances. Now let us talk about illicit traffic. In relation to narcotic drugs and psychotropic substances, we are talking about illicit traffic. Traffic तो एक गाड़ियों का जाम जो होता है वो होता है, but we are talking about illicit traffic. So let's discuss this word trafficking, illicit drug trafficking with respect to narcotic drugs and psychotropic substances. We have seen that the main aim of this act was to control the operations with respect to narcotic drugs. So the operations include, that is the cultivation process, procession, selling, etc. So if the things are not done by the law or the governing authorities, and people are using it for smuggling or for taking benefits from this, then it is termed as illicit trafficking. Or for, let's see in detail, the cultivating any coca plant or gathering any portion of coca plant, cultivating the opium poppy or any cannabis plant, engaging in the production, manufacture, possession, sale, purchase, transportation, warehousing, concealment, use of, consumption, import, interstate, export, interstate, import into India, export from India, or transshipment of narcotic drugs or psychotropic substances that we are talking about with any kind of operations with respect to these narcotic drugs comes under illicit traffic. And if we are using these drugs for smuggling purpose or misuse of these drugs, then it comes under this illicit drug trafficking. So here is another point, that is controlled drug delivery. Controlled delivery means the technique of allowing illicit or suspect consignment of narcotic drugs, psychotropic substances, controlled substances, or substances substituted for them to pass out or through or into the territory of India with the knowledge and under the supervision of an officer imparted in this behalf or duly authorized under Section 50A with a view to identifying the persons involved in the commission of an offence under this Act. If all this is taking place under the supervision of the government authority or the person assigned for it, then it is termed as controlled delivery. Manufacturing of these narcotic medicines under controlled person or the authorized person is termed as controlled delivery under Section 50A. The point to be remembered over here is that Section 50A of the Act allows or states the authorized person who can be used to control the delivery. So we have seen some of the important points and we have covered, let's have a brief review over it. We have done the introductory history part, then the introduction, objectives, definitions, and in the definitions I have covered some of the drugs which are included as narcotic drugs. So with this whole, I am concluding over it that you have been laid down a brief idea of narcotic drugs and psychotropic substances and what were the aim to start this Act. I will be coming up with the next important details over this Act in my next sessions. Thank you.